This is my client, Ian, and he was treated rather aggressively with lots of leg tugging, and this caused a downslip pattern of his left ilium, and he thought that that was the problem, but he couldn't find any practitioner that would evaluate him for such. So he came to Denver to see me. And what was your response to the first visit?
Amazing. Without any manipulation or any joint manipulation anyway, I got an immediate relief of my original problem, which is the downslip. It was noticeable within 10 minutes.
How did the downslip affect you?
The downslip caused me to sit unevenly, caused me to put a lot of weight onto one side, my right side, sit bone, and also when exercising, cycling and running, there was a noticeable lack of movement on the left side where the downslip was. It was stuck essentially, so trying to accelerate on the bike or running, trying to sprint or run was noticeably, there was a range of motion, a movement problem on the side of the downslip.
And you had ankle surgery 3 weeks ago, so you weren't able to bicycle yesterday after treatment or run.
No, but I was
so what was noticeable in response to treatment?
It was more balanced, more even. I was no longer, not that I was walking with a noticeable limp, but I noticed there was a definite range of motion issue on my left side. I wasn't as flexible, and so I was walking slightly off center, if you like. That's been corrected now.
And how about your upper body?
Upper body, there's less strain on the right side of my back now.
Yeah, your left shoulder girdle was really far forward when you walked.
Noticeably different.
And that's much better. You noticed especially when you stood against the wall.
Yes, previously when I would stand against the wall, my right shoulder blade would touch the wall, and my left shoulder blade would be about 3 or 4 inches away from the wall. Now that's probably about less than half an inch. It's much closer.
And I noticed that your left shoulder blade was 2 inches lower.
Yes.
And is that correct? It was lower, yes. Yeah. And then after correcting the pelvis, it reduced by 50%.
Yeah, certainly. It still drops slightly, but it's not anywhere near the level of drop that it was prior to the treatment.
Now, after correcting that pattern called a downslip, how long did it take for me to correct that?
Probably less than 15 minutes. The treatment itself, the diagnosis took a while, and then just to make sure that we had the correct diagnosis, and the treatment was about
It was 5 minutes.
Yeah.
5 minutes.
Yeah.
Yeah. Now, in this model of care, on the internet, all the experts are arguing against the biomechanical model. But there's a place for the biomechanical model. And I think that everyone that comes to see a physical therapist, they deserve a thorough evaluation. And the patient deserves to be listened to. And if the patient says, I think I have a downslip pattern because this changed after vigorous leg tugging, and it feels like this and so, then I think that needs to be listened to and looked at and evaluated. Now, we corrected that downslip. Did I tell you to come back and see me 12 times for me to adjust your pelvis?
No.
What did I do?
You corrected it and then told me that should, and it has, been corrected pretty much for good, and you gave me a couple of exercises to do on my own should I need them to ensure keep the maintenance of the problem should I need it.
Yeah, and you live in Houston and you travel around the world in your occupation.
Yes.
What if you had a downslip repeat and you just knew that it was the same kind of an injury and such? What would you do?
I would use the self-correction exercise.
Exactly. So you're independent in self-treatment.
Yes.
So my answer is that, this model of being thorough in a biomechanical model, a biomechanical evaluation and treatment should be a one-time intervention. Mm-hmm. Now, of course, you want to come back and reevaluate it and make sure that what you tried to treat was successful, and if not, modify and so on and so forth. But we successfully corrected that aspect of your injury and taught you how to be independent. So this model is a treat one time.
Yes.
Okay? Teach the person how to manage it, and move on to other things.
Yes.
Now, you have a lifelong history of a scoliosis. And you have a developmental asymmetry of the pelvis such that today we worked on another pattern. It's a pattern that I've described, and it has 5 components, and it's called lower windswept pelvis. And so we worked on that, and we gained some mobility, and we gained a little more symmetry, and we gained mobility with these passive spring tests to the lower pelvis, which are not described in the traditional model. And what we came up with was a barrier where I could get you closer to symmetry, but there was we restored mobility, but your pelvis is developmentally asymmetrical. So we know the limits of my intervention. And so this is where I evaluate you in sitting, because let's just say that in standing, your pelvis has a certain asymmetry and your body compensates well. But once you sit in the chair is trying to force a false symmetry on a pelvis that has developmental asymmetry. Okay? So the next film, I'm going to stop here because I want this one to focus mostly on the issue of downslip. So in the next film, we're going to film how simple it is to intervene to give you greater comfort in sitting. So I'll stop filming right now, and then we'll start up again. Thank you very much.
Okay.
And I'm a big proponent of evaluating for downslip. It doesn't get enough press. You did a literature search, and you found very little on downslip.
There's nothing. There's your videos, and there's articles that are upslip and downslip, and it focuses only on upslip. They all just say, oh, you might have a downslip, but it's rare, so we're not going to talk about that.
True. And there's also a belief that they self-correct, and that's just not true. No. Walking doesn't correct it. It doesn't create the correct angle of force to make a correction.
If that was true, the amount of running, cycling, swimming that I did, if it self-corrects, then you would have thought that of the thousands of miles of cycling or
that's
running,
right,
that something would have corrected it. So
downslip is a significant dysfunction. It's very unphysiologic. Yeah. And it took a specific angle of force for me to correct it on you yesterday, but it was very simple to find that correct angle, and that angle doesn't even happen during gait. So anyway, there's yes, I'd like to bring more attention to the value of screening for it, treating it when you find it, making the person independent in self-management in one visit.
I think the biggest thing there is being able to diagnose that everybody treats the opposite side and thinks it's an upslip, right? So they'll say, right, okay, look at your right side's high, there's an upslip there, we'll focus on your right side.
Very good.
But that's not the problem, so they ignore the downslip, focus on the high side.
True. In fact, that little boy on my website, on the home page at the very bottom, someone looked at him and said, oh, you have an upslip, and he pulled on that leg, and the boy actually had a downslip.
I've had that too. Like
yes.
People are doing that.
Yes.
Right? So
and the muscle guarding was hiking the pelvis, but within the SI joint, to our best ability to discern with eyes and hands that are skilled, is that the ilium had slipped down on sacrum and was causing a lot of pain. And that's discerned with passive motion testing the tone of the sacrotuberous ligament. It's not arbitrary. It's not based on how it looks. It's based on ligamentous tone and based on passive movement tests. But he was made worse with that leg tug because within the joint it was a downslip pattern, and he couldn't even walk.
Yeah.
He was being homeschooled. This is an athlete. This guy's a 5-sport athlete. And he would put the cane in front of him and hop like a bunny. And we were able to correct that in 2 visits.
Yeah, I mean, from my experience with chiropractors and physical therapy, they don't even do the diagnosis. They prod and find a tight muscle, maybe a tight psoas or a tight glute, and then they work on that for 10 minutes, and then they correct and they manipulate a joint. If the joint is perfectly mobile, it doesn't really matter. They don't focus on actually looking at the diagnosis. They go straight to problem, pain point. I can fix that. Good, you're cured.
Right.
And they don't focus on holistically looking at how did it occur, what's the problem, do a thorough diagnosis, talk about all the different possibilities, and then start working through them, diligently. It's a quick fix is what I find. Too many people in the industry are doing that.
That's sad to hear.
And especially with upslip and downslip, like I say, I mean,
Sure.
that's the biggest thing. It's just the same. You can see 10 different specialists, and you'll get the same treatment, which is they'll just manipulate a hip and say, and do a little bit of ART to release a muscle and go, well, no problem. See how you feel in 7 days and come back and see me because it'll take a few more treatments to get this right. And next thing you spend a few $100s and really got nowhere.
Yeah. Well, I hope to bring more awareness of downslip to the community. I'm one person,
Yeah.
and I'm trying to do my job.
I think it needs it because I think I actually believe there's a lot of chiropractors that aren't even knowledgeable or forgotten that downslip can actually exist. If you bring up the topic of downslip with somebody, they'll go, and then they'll go back to tugging at your legs and doing things and trying to get your legs even, and that's really all they care about. Oh look, your legs are even, therefore that's fine.
Right. It takes a paradigm shift to evaluate it, find it, and treat it successfully.
Like, yeah, my legs are even, but my hip doesn't move. So
yeah, you can accommodate. Sure, certainly.
So you've not solved anything. You've given me even leg, but that's not the problem. So
right.
You've not done anything. So.
Yeah. Well, you've lived with it, so you certainly have some insight into the issue of downslip.
Yeah. No, it's
So
very frustrating.
Yep. Well, thanks for your comments. Very insightful. I appreciate that. And we'll stop filming now.